Hi, my name is Kaylee and I'm a family navigator with Family Voices of Colorado. I'm also a parent who has walked through the transition from pediatric to adult health care with my own child who has a disability. And I'll be honest, it was harder than it needed to be, and in a very challenging time of one's life, transitioning from all of the pediatric side of things to the adult side of things, that is not what we need. That's why I'm so grateful that you're watching this. As professionals, you have incredible power to make this transition safer, smoother, and less scary for youth with special healthcare needs or disabilities and their families. When our kids are little, their pediatric team often feels like family. They know the history, the quirks, the emergencies, the fears. Then suddenly, around 18 to 21 families here, you'll need to find an adult provider now. For families, that can feel like being pushed off of a cliff with very little options to catch you. One of the most helpful things you can do as a provider is to start the transition conversation early, around ages 14 to 16. Not to terrify families, but to normalize it. Ask questions such as your teen continues to grow, we can help them move into adult care. I typically like to transition my patients at whatever age feels comfortable for your practice. What can I do to help that process feel as smooth as possible to you? Transition is not just a referral to a new clinic. It's also about teaching families skills. Involve youth in refill, scheduling, and knowing their meds as much as they are able to. Practice helping youth learn how to explain their condition and needs to others. Talking early to families and youth about consent, guardianship, supported decision-making, and HIPAA so families aren't blindsided at 14 and 18 when their access to records and ability to make decisions changes. Refer out to different entities that can help understand those things. You don't have to fix everything in one visit. Tiny, repeated conversations really add up. Make the handoff warm, not cold. And what I mean by this, a cold handoff looks like, here's a list of adult doctors, good luck. When we talk about that falling off a cliff, that's what it feels like. A warm handoff looks more like helping identify adult providers who actually understand disability and complex care, sending a clear, organized medical summary to new providers, and when possible, having direct communication between pediatric providers and adult providers. That extra few minutes can prevent crises later on and improve continuity of care for the individual and their families to feel more at peace with this transition. As a family navigator, I see every day how much families want to be good partners, but they're often exhausted and overwhelmed with all of the systems that they have to navigate, especially during this transition time. When you slow down, make eye contact, and tell them, we're going to walk through this together. You are not alone. It matters more than you will ever know. Thank you for the care that you've already given to our children, youth, and adults. If you remember one thing from this video, let it be this. Transition is not a moment, it's a journey. When you start early, include the youth, and make a warm handoff, you change that journey from terrifying to possible. On behalf of the families that we serve and the kids who are growing into adults, thank you for being part of their team.